I've been dealing with diabetes for a little bit over 25 years.
I was just eating anything, overindulging to a large degree.
And not being able to have the money to eat the right food. As life went on, things changed and my sugars went up.
I was told what my A1C was. I realized that I was playing with my life. I could have died.
Patients fall through the cracks in the health system all the time. It's really around two main factors: transitions of care and social determinants of health. FoodRx is one of the key interventions that we have to address patients with food insecurity that also have food-sensitive conditions like diabetes, CHF, heart failure.
The FoodRx program started in 2021 here at MedStar Good Samaritan Hospital, and we are here to assist patients who live with chronic disease, diabetes, hypertension, heart disease, and it involves helping patients who have some level of food insecurity and helps them learn how to manage their chronic illness, primarily with food, in addition to medication, but also to look at their life and lifestyle and see if they can make some changes that would help improve. Patients come to the FoodRx program through the Collaborative Care program. It's a clinic within MedStar's Good Samaritan Hospital. Patients also come to us from hospital discharge. They can have referrals from their primary care provider, and they can also self-refer.
I was very excited finding out that I could be a candidate for FoodRx.
When I started the program, I was sluggish. I wanted to nap all day. I wasn't paying attention to what I was eating. I wasn't hydrating. I wasn't doing any of the things that I'm supposed to do at my age.
The biggest mistake that oftentimes I see happening is that we don't pay attention to our food choices. And that can bring too much salt, too much sugar, too much cholesterol, causing heart disease, diabetes, hypertension, and heart failure. And if we can control the choices by giving the right advice to our patients, that's exactly what food as medicine is.
Food as medicine means that in addition to treating a patient with medicine, we also use food. Food is nutritious, it's essential, and in the United States, a large percentage of our population live with food insecurity and hunger. Food as medicine helps to even that playing field for those patients who cannot afford fruits and vegetables and nutritious food to eat.
I had to change my diet. I had to change the activities that I participated in. I had to not only take the medication, but eat properly and exercise. And I thank the FoodRx program for making me aware of how I wind up if I continue eating the way I was and not exercise and so forth.
The dietitian sees the patient once every 2 weeks, and there is always some type of diet education and or a reinforcement and just review and a reassessment of what we talked about in our prior meetings.
When we think about overall health outcomes, we know that about 20% of those health outcomes are due to the medications that we prescribe, the surgeries that we do, the different lab testing that we do. But the other 80% of what contributes to someone's health are those social factors, the circumstances in which they live.
FoodRx has really been a game changer for the patients who come through this program. Not only do they enjoy the interaction, but they enjoy seeing that they were actually capable all along of managing their health. They just didn't know how to do it.
The best part of the FoodRx program was meeting Angela and her teaching me how to deal with the meals, make the meals, and bringing down my A1C level.
Hemoglobin A1C is a blood test that we measure, and it's a good marker that we usually follow to tell how somebody's sugar control has been.
Managing any chronic illness is a level of confidence and a level of education, right? You have to really understand what diabetes is and how it's affecting the body to really make better choices when it comes to the food you eat.
I make the referral to the Collaborative Care program in FoodRx quite frequently for patients who just got diagnosed with diabetes because it's overwhelming to have diabetes.
The decisions about when you take your medication, how much you take, and without a deeper understanding of it, it's hard to make those good choices.
It takes a while to learn all the tricks and the behavioral changes that the patient needs to implement in their lifestyle to get it under control. It's a multidisciplinary approach.
The FoodRx would not be as unique and well-rounded as it is without all of our community partners. So the YMCA is one of our community partners and offers our members in the FoodRx program a 6-month family membership at no cost. We also have organizations or companies that help deliver our fruits and vegetables, deliver our produce to our patient's door. We also work with First Fruits Farm, which is an organization, a Catholic organization, that grows food to give it away. And so working in conjunction with First Fruits Farm and with the Franciscan Center, we're able to actually bring fresh fruit and vegetable into a hospital setting and provide nutritious, nutrient-dense food at a patient appointment.
You are what you eat, and food has a tremendous impact on someone's health.
I feel wonderful. I get up every day, no headaches, no pains, and eat the things that I've been instructed to eat by the FoodRx program.
I carried on what I've learned from the FoodRx. Since then, my A1C level has changed tremendously.
I get a lot of nasty looks from a lot of people in my age range because I still have mobility and agility. And don't be mad with me. Do what I did. Eat right and exercise.